technical challenge to get these things up and running. I'm Gretchen Burns Bergman, co-founder and executive director of A New Path, Parents for Addiction Treatment and Healing. We work to reduce the stigma associated with drug use and substance use disorders. And I'm the lead organizer of our Moms Unite to End the War on Drugs campaign. We work to destigmatize and decriminalize drug use and addiction. We've got 35 states across the country with representatives for the work that we're doing. Today's interview is part of our Moms 2020 Vision Global campaign. We are working with the United States, UK, Canada, and Mexico to promote therapeutic and compassionate drug policies. So I am joined today by the president of the board of A New Path, Caroline Stewart, and with Leslie McBain, founder of Mom Stop the Harm in Canada, and Jennifer Howard from Mom Stop the Harm in Canada. And so we'll be discussing the campaign, but first, I'd like to kind of introduce you to everybody. So Caroline, we'll start with you. Caroline is an LCSW, president of the board, as I said, and a fierce mom.
Thank you, Gretchen. Well, our son is just turned 39 years old, and he's been struggling with opioid dependency for about 20 years. He's currently approaching 1 year of sobriety after 18 months homeless and a year of incarceration. So our family has been through hell. We love our son. We believe in him. He is a decent, good man, and he struggled with addiction. We believe it's a brain disorder. It's not a character defect. I was a professor at San Diego State University 20 years ago. I was teaching a class in the School of Social Work about human behavior. And I read an article about Gretchen Burns Bergman in our local newspaper. I invited Gretchen to come and speak to my class about the fact that we needed to take the stigma out of the whole issue of substance use. And Gretchen, I so loved the mission of A New Path that I became the president of the board, and I pretty much most of the last 20 years have been the president of the board. Our mission is, as I said, we've got to take the stigma out of substance use disorders. It is a brain disorder. It is not a character defect. Our current biggest mission, and the one that fills my heart with great pride, is that we are the largest Narcan distributor in Southern California. And we go anywhere and everywhere where individuals would receive our Narcan and save lives. We have saved over 530 lives since we began this mission. I run a support group for parents and family members that have co-occurring disorders. That means individuals with both psychiatric illness and addictive illness. I worked 20 years in the Department of Psychiatry at UCSD, and probably 80% of our intakes were co-occurring disorder patients. It's rare to have a psychiatric illness and not start to use substances. So that's what we do, and I'm very proud of our mission. Thank you.
Thank you. And A New Path was started in 1999. And if you saw the interview that I did on Mother's Day with my two sons, you would know our whole story. And it was my role as a mother that brought me into this advocacy work 21 years ago. So I'm going to move to Leslie McBain, who's one of the founders of Moms Stop the Harm in Canada. And if you can tell us a little bit about your mission.
Sure. Thank you, Gretchen. My son, Jordan, died of a prescription drug overdose in 2014. He was just 25 years old. He had started using drugs, probably, it's hard to know because it's sort of a black box with teenagers, but somewhere in his late teens. He then had a back injury, ended up being prescribed oxycodone, which is here in Canada, for 7 months in ever increasing amounts by our family doctor. So he became addicted quite quickly and So the short story is he sort of doctor shopped and got quite a few different drugs and took therapeutic amounts of them all at one time, and it stopped his heart. And he was, like I say, 25. About a year, or even less than a year later, I met Petra Schultz. Her son Danny had died around the same time from a fentanyl overdose. We then met Lorna Thomas, whose son had died of drug-related harms. It took us about a year, but we formed Moms Stop the Harm, and that would be in 2016, really, when we really got going. We are represented across Canada in every province. We have about 1,300 members at this point. Our mission basically is we have a two-pronged approach. One is to advocate to all levels of government for better and evidence-based and compassionate drug policies that support the lives of drug users. And that's where we started, and we have evolved into as well support groups, which Jenny will talk about, for people both who have lost a loved one, usually a child, and support groups for people who have a loved one still struggling. So at this point, we're all quite involved in government. We're on committees. We are listened to. We are, at this point, respected as the voice of the moms. And so we're pretty happy with our position. We are not happy with the glacial pace of change wherein people are dying every day. So we keep going. So that's sort of the short story of our organization.
Mama Warriors, you've really accomplished a lot since 2016. It's amazing.
We have.
Yeah. Jennifer, can you tell us your involvement?
Yes. My only son, Robbie, died of fentanyl poisoning in May of 2016. And Robbie was one of those individuals and statistics that we see of young men and women hide their addiction in the privacy of their own home. Robbie died alone, not disclosing his use of drugs. And that at that time, I really was one of those uneducated family members who really didn't have a lot of depth of experience around addiction and the challenges of addiction. And also fell into that thinking that somehow Robbie would have control to stop. I've learned a lot since the loss of my son. And part of my education and learning has been connected to Moms Stop the Harm. I met Leslie at a vigil. She spoke just shortly after I lost Robbie. And I was in the depths of my grief, and I heard her speak and knew that this was a network that I needed to belong to and to speak up for many other families who are struggling to support their loved ones, and to really speak up to change very archaic drug policies that exist right now. And so that's been my journey in losing Robbie. And like many families involved in Moms Stop the Harm, we remember and honor our children and all that we do. And part of that journey is with Moms Stop the Harm, we've developed some support groups for families, and I'll speak to that later in the interview.
Yeah, thank you. I think we all have this sense of turning our life's journey, which was so filled with drama and trauma and pain and loss, into something positive. And I think it turns out to be therapeutic for us, because for me, a sense of powerlessness when you're watching something so wrong going on is deeply painful. And I think that being able to bring all these mothers' voices together now, not just in the United States, but we're connecting with moms groups all over. I think that we can be quite instrumental in change if we bring all of our voices together. So thank you for your work. So part of the Moms 2020 Vision campaign was to put forth, if moms ruled the world, right? If we were in charge of drug policy, what would we do about this? I mean, I say we're living in a dual crisis right now of COVID-19 as well as opioid overdose. So what would moms do? And so we have 8 proposals that we'd like to share, and I'll ask each of you to comment on them. But the first one is mine. The first comment is stop criminalizing our children who use substances. You know, as simple as that. It's what we've been working at for 21 years. Therapeutic, not punitive drug policies. Get the criminal justice system out of it and put it squarely in the hands of healthcare professionals and society to deal with this. So that's a number one issue for us. And as I had shared last week, my older son was in the criminal justice system cycling through for 11 years. For the first offense was marijuana possession. Now that would not, in California, would not even be a felony. Or against the law. So number one is stop criminalizing our children who use substances. Number two, I think I'm going to kick to Caroline as an LCSW professional. We're calling for training for healthcare providers in evidence-based addiction treatment.
Yeah, so I began my internship in the Department of Psychiatry at UCSD in 1983. My son, who wound up struggling with substance use disorder, was 2 years old when I started my profession. Back in the 80s, the clinical treatment of addictive illness was perceived as none of our psychiatrists wanted to do work with those struggling with substance use disorders. It was a horrific cultural place of kind of compartmentalizing those patients and forcing them into a character disordered venue, if you like. The doctors did not see it as a brain disorder. The good news is, I have very good news, is that probably one of the most competitive residencies right now is substance use disorders residencies. Our psychiatric doctors now understand and embrace the truth that this is a medical clinical condition, and that's a hallelujah. However, in 2008 in the United States, Senator Paul Wellstone came up with legislation saying that substance use disorders and psychiatric illness were clinical illnesses, and mandating coverage from insurance. Now, in Canada, you have public insurance. I know I used to use it, it was wonderful. We have private insurance in the United States. I want to tell you, very few patients still have good private insurance for the treatment of substance use disorders, and that's horrific. Finally, I want you to know our son, when he came out of his treatment program, was on MAT, Suboxone, medication assisted treatment. And we were blessed only by luck to find a sober living that would allow our son to live with them. Had he not had that, I think he'd be in the street again, on the street. The sober living has been sophisticated clinically. They've embraced our son, but that's because they have a clinical approach. We need to have more of the clinicians talk to the programs like sober livings, the non-clinicians, and educate them to stop the moral judging. It's killing our children. Thank you.
Yeah, thank you. The third proposal is better coordinated response to the overdose crisis by all levels of government. This is a frustration in many countries. Certainly it's a frustration in the United States, but I'm kind of getting the feeling that you all are doing a bit of a better job with that. They're listening to your voices in Canada. So I'll let you speak to that.
I guess it's all relative. And so we feel that, yes, we're being listened to by all levels of government, which is municipal, provincial, and federal. And some things are breaking loose during COVID. Now we're having some success with a risk mitigation safe supply, and this is something that, oh dear, there's my dog.
Join the conversation. Here,
What's happening? Can I? Excuse me, everyone. I have to yell at my dog. Rascal, 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 come here.
the dog hears Mama talking.
Yeah.
Okay. So the federal government has given an exemption for opioid and certain opioids to be released, to be prescribed by medical practitioners, so that people who use drugs won't have to go to the street, be on the street corner, not self-isolating, and so on. All the risky behavior that goes with accessing the drugs they need. So there is a little bit of coordination. We're working on it. Our province of British Columbia rolled out this particular guideline just a few weeks back without the infrastructure behind it to actually make it work. And this is a great disappointment to us. And we're working really hard on that right now. Mom Stop the Harm, as well as drug using groups, advocacy groups, and doctors, and a lot of us are trying to make that happen. I think that because we have strong advocacy in Canada, and among, like I say, different sectors, people who use drugs, people, families, legal profession, and a lot of physicians, we are making more progress. Also, we're a much smaller country. Obviously, we have, I think, about 35 million people. Everything is a little bit easier to move, and there is more connection between the provinces and the federal government. Having said that, what we are aiming for is regulated, legal, safe supply of drugs. We concentrate mostly on opioids, but we don't ignore the stimulants or benzodiazepines or other drugs, but mostly the opioids, because that's what's killing people because of fentanyl. So if we could just get everybody on board with a low barrier, and even medicalized, although we'd like in the future, that's another fight, we'd like to not have drug prescribing, or people who need drugs because of their disorder, substance use disorder, not to be medicalized, to be just like people who are using alcohol and who are addicted to alcohol don't have to go to a doctor to get alcohol. Same with cannabis. People are using cannabis now here in Canada. You just walk into a store and get it. And that is actually how most drugs that people need should be. People should have, that's what we believe. We believe that people should have the option. So the question was, how coordinated are our levels of government? It's spotty. Right next door to us is Alberta, and they're very regressive. We are the most progressive province. They're the least progressive province. So, it's spotty across the board. It's complicated as all this whole file is.
Yeah, it's the same in the United States. Different states are at different levels of this as well. I'm going to kind of race through a couple of these because I think we all agree. Implementation of drug policy reform, including decriminalization of drugs for personal use. I think we're all aware of some of the other countries who have decriminalized drugs, such as Portugal, very successfully bringing down HIV, Hep C, drug use in general, certainly overdose. So I think that we're all on board with that one. So I'll just go on to the next one. It's education around a compassionate public health, family-centered approach to substance use rather than a criminal justice approach. I think we added the family-centered approach because there were years when the parents were looked at as the problem. And that's part of our True Love, Not Tough Love campaign, is not accepting that whole enabling and codependency model, but bringing the family into it, because the family's where they're going to come back when they find recovery, right? So if anybody wants to chime in about that.
Well, I have something very, so as a clinician, I do a lot of public speaking. I tell the audience that maybe once a week, I will get 4 or 5 brochures inviting me to train to be a trauma-informed therapist. And frankly, I'm going to say, I have no problem with helping people who have had trauma. But the problem with those trainings is that always trickles back down to parental blame. I'm sorry. It's a very sad connection where the trauma-informed therapists are not understanding that a lot of the trauma occurs after the substance use begins, not because the parents spanked their children too hard.
Right.
The
Yeah.
parents didn't, most of the parents didn't spank their children at all. So I'm actually complaining more about my clinical profession that has this love affair currently with trauma informed therapy. And it's a little bit like Freudian therapy where the schizophrenogenic mother, if the person has a drug problem, it must be that they had a bad mother. It's very, very old fashioned bad thinking. And I'm afraid, you guys, it's a thing right now. It's a fad, and clinicians are embracing it as a big deal. So I just want to put that out there. It's becoming a problem again. It's like we're reverting, we're losing ground, and saying it's a complex medical condition with complex synergy of a variety of brain, environment. Our son's learning disabled, severely learning disabled, very smart man, but very learning disabled. This is not a time for us to be focusing on blaming parents. We need the parental abiding love and support of their children, not that they are the bad guys.
Well, I'm gonna skip to the eighth one and come back to the others because I think it's a good segue. When we were coming up with these proposals, working with other countries, in Canada, you all wanted to really include this last one, which was grief and trauma support for those left behind. I'm gonna keep this to Jennifer for just a moment because. I have not lost my sons. There were decades when I thought that was an imminent possibility. But our family still went through a lot of grief, a lot of lost celebrations, a lot of, so grief and trauma for those left behind is very real, particularly when the ultimate worst thing that could ever happen to a mother happens. So you want to speak to that one?
Absolutely. And just to start by saying, I want to acknowledge the many families right now who are losing loved ones due to this overdose crisis, but also in combination with the COVID pandemic, and how challenging it is to deal with your grief and loss in a normal climate, let alone having the pandemic take place and feeling isolated in your grief. I think for me and for Moms Stop the Harm, we really recognized that this was a needed support for families. There's many drop-in grief support groups who are wonderful. But for families who have lost a loved one due to substance use, there's so many layers involved to that loss. And what families have shared with us as a network, we developed grief support groups called Healing Hearts, and we run 11 groups currently across Canada. And what families have said to us and given us feedback on is that it really is a safe place where there is no stigma and there is no judgment, where you can share your grief journey. And part of that journey for families is sharing the chaos of supporting a loved one over many years, only to have to deal with the ultimate traumatic loss. So it's something that families need more of. It's something that families recognize is a tremendous support to them. And I often say to people when I talk about our Healing Hearts support groups that right now we have over 14,500 families across Canada who've lost a loved one to an overdose. That's a lot of people grieving. And it's an important and needed support when we look at what's going on with this crisis.
Absolutely, and this is global, and there's many other groups like that, like GRASP is I think worldwide now too. So just take a second to take in the numbers, the amount of precious lives that we've lost, and too many times really unnecessarily so, and so that's I think why we're so passionate about changing laws and policies and the perception of drug use and substance use disorders itself. I'm going to go back now. The sixth was increased support for mothers across borders who continue to be affected by the war on drugs. And then we added this because we know that there's really discrimination associated with the war on drugs. So we say particularly the moms that disappeared in Mexico, their children have just flown off the radar and they have no way of finding them. But this is the drug war violence at its worst. And in the Indigenous women in Canada, so whenever you have these minority populations, or do you want to speak briefly to that about the Indigenous women in Canada and how they're more deeply stigmatized?
Sure. I would even say Indigenous women, but certainly Indigenous families and different tribes actually are facing huge discrimination. In fact, right now during COVID, it's even worse because they're on reserves and they are don't have good health services. They don't have the support they need for harm reduction, for just for treatment, and there's very few doctors in general in those areas. The ones that they have are fantastic. For Mom Stop the Harm, we have realized that not very many out of our 1,300 members, I'm going to guess because I don't know for sure, but say that we probably have 8 members who are First Nations, and I totally get it because we're predominantly white. Our organization is predominantly white. How risky would it be for an Indigenous family to reach out to us, who in history have been the oppressors? And I've talked to Indigenous friends and moms and doctors about this. And so it's a problem that we see and we understand and we work on it. But at the same time, it requires sensitivity and training. And so we're not there yet. We would love to have a contingent of First Nations, and we certainly take direction from them and from how they handle within their communities and within their families addiction and all the harms that go along with that. However, we're just not there. We have nothing to offer except welcome. So yeah, we're a little bit hooped with that. We're not sure quite how to tackle that.
So,
Yeah.
so Leslie, let me add, before I was a psychotherapist, my husband and I are anthropologists, and we lived with the Eastern Cree in Chibougamau, up in the subarctic of Canada. And we have connections. I think what we'll do, my husband's an activist as well. We'll see if we can help connect some of our contacts with you folks.
That would be lovely.
Yeah, that's a great
we work
thing.
on it.
Yeah.
Yeah. In British Columbia, and I think in other provinces as well, there is a First Nations Health Authority.
Right.
And we work with them. There's some really amazing women and men too in the Health Authority, but they help connect us. But we've got, well, like in the US, such great distances between, where I live and up north, where a lot of communities that are pretty much ignored. I've been up there. We had a program called Stronger Together that we did, which was so wonderful because people within the communities were connecting with each other. People who didn't actually know each other, but were living with a loved one struggling, suddenly met. And, you know, when we walked away from there, they had connected and are going on still.
That's,
So,
I would love to help you with this.
yeah, it was really, that was a terrific thing. But we're spread so thin, as you
I know.
guys are too. You know,
Yeah.
it's hard to gather
Yeah.
everything.
Yeah. But I think that, I mean, that's the power of these kind of coalitions and joint campaigns is recognizing that there's so many of us and we are not alone, and our voices are powerful. The last one, which is actually number 7, is promote maternal values. We're tired of paternalistic, you know, hammers on the head kind of approach to things, and recognize the power of maternal love. So we're saying reject the concept of tough love, and reject the drug war, which is not a war on drugs. It's a war on our families. And so I think we're all united in that effort. The Moms United to End the War on Drugs campaign, collaborative global campaign. So does anybody have before I do the last parting words, does anybody have anything that burning desire to say, something that didn't get said?
I would like to just on that point, on your point that you just made, tell a very brief story. I was at a conference, and in the audience were quite a few people who use drugs or who are in recovery, peers we call them. And one of them, who I totally respect, is a great advocate, stood up and said that I'm the mother he wished he'd had, and that I'm the mother that all drug users wish they had. And that touched me so much, because I wasn't that mother when my son was alive. But what I've learned since is what we as moms need to do to hold our children. And so I will never forget that, and it made me be a better mom to people who use drugs.
Yeah. Well, go ahead, Jen.
Oh, I was just going to add, you know, Leslie at one point has said when she does presentations, our stories are the best tool in our toolbox. And I've always liked that, because that is the collective power of moms in sharing their stories and really breaking down the stigma, which is underlying all of the things that we're talking about today to improve supports to people who are struggling. So, yeah.
So please share our stories, share the link on social media. If you came in late to this interview, you can just wait 10 minutes and it'll play again from the beginning, and you can watch the whole the video, but please share it. It's the power of our stories. Also, as part of this is a month-long campaign, because of course Mother's Day is celebrated on different days in different countries. So we chose the whole month of May for the Moms 2020 vision. And a part of it is sharing, is planting forget-me-not flowers in honor of those who have lost their lives or liberties due to the global war on drugs. So please plant the seeds for tomorrow, right? So next week, the 22nd at 11 o'clock, I'm going to be having a conversation with our partners in UK, Recovering Justice. Fiona is actually in Scotland, so please join us then, and join our campaigns wherever you are. You can either join on our websites, on the Moms Stop the Harm website, or the Moms United to End the War on Drugs website, which is momsunited.net, or a New Path website, which is anewpath.org, or on social media. Join our campaign, and happy May Day, Mother's Day to all of the mama warriors out there. Thank you for joining us.
Thank you.
Thank you.
Bye-bye. Thank you
Thank
so
you.
much. Bye-bye.
Bye-bye.